The Health Ministry is set to decide this afternoon how many additional medical school seats to add, a move that faces strong backlash from doctors. The government has been pushing to increase quotas outside the capital region, as it estimates the country could face a major shortage of doctors over the next decade. Our Park Kun-woo explains more.
Additional admissions for 32 regional medical schools outside Seoul for 5 years from 2027 are set to be decided by the Health Ministry on Tuesday. The decision will be made at a meeting of the Health and Medical Policy Committee, which will be followed by a briefing where officials are expected to announce their conclusion. The Health Ministry said last week that South Korea could face a shortage of around 4,800 doctors by 2037. Because of that, officials say around 4,200 additional doctors are needed through expanded medical school admissions. The figure excludes about 600 doctors expected to be supplied each year by a future public medical school and newly established regional medical schools by 2030. The increase is expected to be implemented under the regional doctor system, which selects students from non-metropolitan areas and requires them to work in public and essential medical sectors in regions with limited access to health care for at least a decade. During the meeting, officials are expected to decide the annual scale of the increase and the exact number of additional seats. However, the Korean Medical Association is expected to hold an emergency press conference after the Health Ministry's briefing on Tuesday in opposition to the plan. The group has urged the government to halt the expansion, arguing that the calculations lack sufficient scientific evidence and that the decision is being rushed. The government aims to finalize the plan by the end of this week, so universities can announce their early admissions guidelines by May. Park Kun-woo, ArirangNews.